Regardless of your age, get medical attention if you are having issues with your ability to urinate. Welcome to Medical Made Easy. In this video, we are going to discuss causes of problems with urine as men age, identification of urinary issues with an enlarged prostate, self-care techniques for urological issues, treatment options for enlarged prostate. As men age, many men get urinary problems, which may be brought on by prostatitis or inflammation of the prostate gland. Benign prostatic hyperplasia or BPH is a benign, non-cancerous growth of the prostate that can cause blockages in the tubes, causing discomfort in elderly men. The most typical symptom is having trouble voiding. Urinary symptoms might get so bad that they need to be treated. Not every urine symptom is brought on by modifications to the prostate. Furthermore, some men have enlarged prostates yet show little to no symptoms. Urinary symptoms need to be monitored. Consult your physician if you suffer from having trouble urinating, having any blood in the urine at all, any unusual discharge from the penis, severe or persistent incontinence, inability to hold pee. Identification of urinary issues with an enlarged prostate. Regardless of your age, get medical attention if you are having issues with your ability to urinate. You might need to have a few tests done if your doctor determines that additional assessment and therapy are necessary for your symptoms. A general checkup, which includes a review of medical history and any illnesses such as diabetes, obesity, obstructive sleep apnea, depression, and erectile dysfunction, may be one of these. You could have a rectal examination to determine the size and form of your prostate gland. A flow rate check to gauge how quickly you pass pee. This determines whether your prostate is infected. An ultrasound examination to assess if the bladder is emptying completely and to examine your kidneys. Urodynamics. Depending on the situation, a battery of tests on the bladder to assess the health of your urinary system may be advised. Self-care techniques for urological issues. The following actions are things you can do at home if your urinating issues are minor and do not disturb you. Cutting back on alcoholic and caffeinated soft drinks as well as coffee. This is particularly crucial before bed if having to wake up in the middle of the night to go to the bathroom. Modifying your diet to cut back on processed foods, especially refined carbohydrates. Getting more exercise. And learning pelvic floor and bladder retraining exercises, which can help with some urinary symptoms. Consult your physician for further guidance. Treatment options for enlarged prostate. Once an enlarged prostate is identified as the issue, there are numerous treatment options available. No medical intervention. Not treating it at all is one of the earliest and most popular options. Patients' symptoms differ greatly from one another. A cautious approach might be appropriate if a man only experiences minor symptoms, such as waking up once nightly to urinate. Dietary and lifestyle modifications. We might advise patients to quit smoking or cut back on their consumption of alcohol, coffee, and tea, as well as dietary changes. These all irritate the bladder. Limiting fluid consumption in the late afternoon and evening helps avoid waking up to go to the bathroom. Medications to increase urine flow. Alpha blockers are oral medications that relax the muscles surrounding the prostate and bladder neck, allowing for more fluid movement in the urine, and are typically the first line of treatment if and when a patient needs intervention to provide relief. They are the most affordable choice and are effective for the majority of people. Most people see alleviation in a few days. However, this medication has the potential to induce retrograde ejaculation, which is ejaculation that enters the bladder instead of the penis. Prostate shrinking medications. Another medication called 5-alpha reductase inhibitor does reduce the prostate, but it takes longer to start working and may have unfavorable side effects for sexual activity. We don't usually recommend it. Tadalafil, a drug for erectile dysfunction, is a far better choice. Additionally, it eases muscle tension. Additionally, combination therapy are offered. Medical procedures. There are surgical options available if medications is not the cure. Prostatic tissue is lifted away from the urethra and sutures are used to hold it in place during the prostatic lift surgery, which is one of the safest and most promising of these procedures. Sexual function is preserved via this minimally invasive outpatient technique that can be performed under local anesthetic. The latest research demonstrates encouraging outcomes. Patients were still benefiting from their lifts when it was reviewed 4 years later. There are alternative treatments and operations available if this surgery is not appropriate for you, including robotic removal of the prostate in more severe situations. Men should not dismiss issues related to urinating as trivial or something that is inevitably arises with age and cannot be prevented. They should be examined to make sure nothing major is going on. If an enlarged prostate is the issue, there are numerous methods which can assist them. They should not have to endure the discomfort, and they should not for the sake of their health. That's it for today's video. If you liked today's video, please give it a thumbs up. And please do not forget to share it with your loved ones. Also, do not forget to subscribe to my channel so you never miss out on any informative content like this one. Stay happy, stay healthy. Till next time, bye-bye.